Hi, it's Kate again, and I wanted to tell you something that I'm not sure you're aware of. Are you aware that the compliance team wrote a patient-centered medical home program just for clinics? Now, we've expanded it now to primary care practices, but this is where it started. So why become a patient-centered medical home in 2021? Well, first, patient engagement. Your patients feel empowered and utilize fewer staff resources when you're a patient-centered medical home. It's support for chronic disease. It's 24/7 access to your clinic. And you will have improved outcomes. Your care coordinator is going to work with your diabetics, your A1Cs over 11, and months later, there's going to be a change for that patient. She may decrease her meds. The patient is still in the program and tells us these are the reasons she's been able to regain her health, because of the care coordinator and the time it took to work with her. Decreased ED use, and that's one that your payers will like a lot, because those high-risk patients, you'll work with them, they won't go to the ED, they'll come to see you. Increase in revenue. Many states pay a bump, a PMPM, for when you're a patient-centered medical home, and it's different in every state, so call me and we'll talk about that. The decrease in hospital readmissions, another big one that Medicare just loves that one. Do you realize that 50% of the prescriptions written last year were not filled or were used incorrectly? Those calls with medication management are going to help with that problem as well. A follow-up call for discharge within 24 hours is going to prevent many readmissions. You'll have an increase in market share because you're going to be the provider of choice in your neighborhood. You're going to have increased staff satisfaction. Now, that's very hard to see in the first weeks as you're preparing to become a patient-centered medical home, because everybody sees it as more work. But once you get in the role and you find your mojo, you're going to be really good with patient-centered medical home, and your staff will have increased satisfaction. So now you've got happier patients, happier staff, and your care coordinators are feeling pride in what they're doing to help your community and your resources. So it's a great thing to do. Call me or email me and let's talk about why this is value for you.